My name is Debbie Fearon, and my husband participated and helped begin the work of Good Sam, I guess 15 years ago. Frank had been praying for a couple years. He really wanted to be used by God in the field to help people who were in need of medical care. They came to find that there were several other people involved at Perimeter who were also feeling that God was calling them to help with something like that.
We often refer to ourselves as a small church, making a big impact. And what we want is we want people to come into the doors and feel that they are being cared for the way that Jesus cared for and still cares for the church. And so one of the things I tell my patients frequently is that we are not just a medical or dental clinic. What we are as a church, that our goal is to spread the love of Christ. And we do that through medical care and dental care, but ultimately at the end of the day, the goal is that these people will come into the clinic and hear about the gospel and feel that they have been loved and cared for and dignified in the way that Christ sees the church.
My name is Silvia Padilla. Voy a Good Samaritan, Gwinnett, hace más 8 o 10 años aproximadamente. Me ha ayudado mucho porque la salud es sumamente cara y obviamente yo no puedo pagar el costo de algunos servicios. Por eso para mí ha sido grandioso realmente Good Samaritano en mi vida. La primera vez que fui a Good Samaritano, pues primero pensé que no era, o sea, lo que me habían contado, pero después que fui la primera vez para hacerme un físico, me di cuenta que realmente sí, o sea, se toman el tiempo para realmente, o sea, hacer todo lo que es el físico. Y cuando vi el precio, pues obviamente también me sorprendió mucho porque o sea, es muy, muy bajo costo porque yo sé que o sea, la salud aquí es muy cara.
I think it's terrific that the clinic is named Good Samaritan Gwinnett because it constantly reminds us of the story of the Good Samaritan. We sometimes forget that when Christ told the story of the Good Samaritan, it was in response to a question from a man. And the question was, who is my neighbor? They had been talking about the 2 great commands, the second one of which is love your neighbor as yourself. And in response to that question, who is my neighbor, Christ gave us the story of the Good Samaritan. So when it comes to our clinic, what is the message there? And I believe the message is that our neighbor is somebody that needs our help. And they may not look like us, they may not have the same ethnic background as us, they may be a different socioeconomic status as us, speak a different language, I don't know. But Christ says they probably are going to be different. It's not going to be somebody that looks just like you. And we live in probably one of the most diverse communities in the country. There has been a long time slogan for this area called Gwinnett, success lives here. Well, guess what? The impoverished and the needy live here also. And the fact that we have a clinic of this stature and this leadership and this potential to take care of a diverse community that is filled with underserved people is a real feather in our cap. And I would hate to see it ever go away because I think it is the essence of what Christ taught us with the story of the Good Samaritan.
Some of the struggles we had in the beginning, we were just new and money was tight. We were operating on a shoestring budget, and just attending the board meetings, hearing the projections and the different things like that, but also knowing that this clinic needs to be up and running. And knowing that we were starting the clinic with prayer, with faith that God will provide for us.
When the ministry first started, it was using a relief model for the way that it engaged with its patients. And what I mean by relief, it was a very typical nonprofit that tried to make its services as affordable as possible. But unfortunately, some of the structure that they put around managing the organization limited the number of people that could access it, and only served the poorest of the poor, which had the least ability to help support the organization through fees. The method of enrolling new patients was called open enrollment, and we only did it once a month. We would only accept 50 patients a month. I was volunteering during those days, and I went from being a counselor to a parking lot safety man, because 250 people would show up as early as 4 o'clock in the morning and stand in line in the parking lot, hoping and praying that the people in front of them would somehow not qualify and be kicked out so that they would advance. And I mean, sitting here now, I can see it in my memory that one day when we took number 50 and shut the doors and told everybody else, come back next month, and just the anguish and disappointment on their faces, literally pressing their faces onto the glass door, looking in, they're thinking to themselves, why can't you take 51?
Our patients struggle to pay their everyday power bills, their rent bills, and when they come to the clinic, sometimes they have to make the decision about paying to see a provider versus paying for food for their kids. And so that's super challenging emotionally, to try and figure out how to give the patient the best care possible at such a low cost. And also knowing the repercussions of that for their family, that they may go home and struggle to put a meal on the table if I'm not wise about the decisions that I make and how I care for these folks. Culturally sensitive medical care is hard, is something that requires a lot of studying and a lot of care, which is something that we want to do. And so that can be challenging, but it is very rewarding to see the patients light up when we better understand culturally what's going on and when we give them the dignifying experience that they deserve.
I learned so much at the Good Samaritan Health Center of Gwinnett, and I carry so many of those skills with me today. I've learned how to extend my passion for medicine to people who may not have the resources to get the care that other American citizens do, and it allows you to be resourceful, understanding. It changes the way you prescribe medications. It changes the way you diagnose people, because you have to consider their background and what they can afford, what's available to them.
I'm grateful to see, just over the 5 years that I was there, just how much God moved in that clinic and opened up doors for us. And then even now, seeing when as Greg calls it 2.0, to see how much it has grown and to see what the Lord has done and how much He has blessed it, it excites me.
It's been fascinating to see how God puts the right people in the right place at the right time for a ministry that He is growing. Greg is an incredible leader. He has vision, and he has led the board in sharing that vision. And the board has had the people on it in the realm of expertise of financial management, of construction, of medical clinics and dental clinics. And we've pulled all those resources to really develop and expand in the form first of the Norcross Clinic and then the East Side Clinic.
I've mentioned our model shifted from relief to development. And without going into the philosophy behind that, the biggest evidence of that change is that patients began to pay more to be served. And we see so many patients today, and we have such great efficiency today, that even though what we charge a patient is only 25% of the typical fee, the retail fee for that same service in the community, their combined payments cover 67% of our operating costs, which is phenomenal. Most people are either 100% dependent on philanthropy or the majority of their needs are dependent on philanthropy. And we've turned that model around where our patients are our number one customer, our number one supporter, our number one contributor, which really changed the dynamic between us and the patient. We recognize that we're dependent on you. You need us, we need you. But in order to keep our fees affordable, we sell them for less than what it costs to deliver it. So we still desire and need donors. And we've had many people be with us for years and contribute to us for years, and we're very, very grateful for that.
We've been supporting Good Sam Gwinnett now for either 6 or 7 years, and it's been a consistent thing that we believe in, especially since we started and seeing the continued growth. I mean, expansive growth. To me, I think what any donor should be considering is what's in the future? What could this do? Not just right now. We want to be part of it.
I think as we look to the future for Good Sam Gwinnett, the next 15 years, there's two important aspects. One is who are we going to be able to pass this on to? Who will be our legacy? And the other is keeping an ear to what the Lord commands. And what is God's vision for where it's going to go? Do we open up another clinic? Do we expand our own clinic? How do we better serve the population that we're set up to serve? And God, I think, has been faithful. He's always faithful, and He will show us what the future holds.
I'm really grateful to see what God has done at Good Sam. And I'm especially grateful for the folks behind the scenes who have been supportive of Good Sam from the early days, back when it was just an idea. The starting was Frank. The starting was David Park and Mike Morris. Those are the guys who said, we have the vision and we want to see how we can make this happen.
I think about the fact that we're created in God's image, and we have dreams. So I believe God has dreams. And 15 years ago, He had this dream that there would be a clinic for the underserved in the Gwinnett community. And it was called Good Samaritan Health Center of Gwinnett. And He has put good people in place to guide and direct that. And I just want to thank all the people that have been involved in it, and thank my Lord and Savior for creating it and directing it, and just say happy 15th anniversary to Good Samaritan Gwinnett.
Happy 15th anniversary to Good Samaritan Health Centers of Gwinnett from our entire staff. We love Good Sam and are grateful for 15 excellent years of service and looking forward to continuing to serve the Gwinnett population in the future.
So on behalf of my family and we want to wish Good Samaritan a very happy 15th anniversary, and we hope there are many, many, many more in the future.
Thank you, Good Samaritan Gwinnett, for allowing me to be a part of your story. Congratulations on your 15th anniversary.
Happy anniversary for Good Samaritan Gwinnett.